Most people imagine cardiac pain is the first symptom or first sign of heart attack, but that is not true always. There are lots of signs that the heart gives months or days prior to a heart attack. Recognizing these early signs will help a patient to realize that he is having a heart attack and will help him to save lives. So these are the 7 symptoms or 7 signs that the heart gives prior to a cardiac attack or cardiac arrest. First is if the patient is having severe chest pain, that is the first sign. The severe chest pain can be in the center of the chest, which will be radiating towards his left arm or towards the umbilicus. Second is if the patient is having pressure symptoms or heaviness in the chest. Third, if the patient has unexplained sweating. Fourth is if the patient has unexplained dizziness. Fifth, if the patient has nausea or vomiting. Sixth is when the patient is complaining of shortness of breath, that the patient is feeling breathlessness on moderate exertion or slight exertion. And seventh is if the patient has sweating. Normal sweating, every person has normal sweating, but if there is unexplained sweating, then this can be also a sign of heart attack that the heart will send as an early symptom or as an early sign. So these are the 7 early signs that the heart gives. So what is basically a heart attack? A heart attack occurs when there is a sudden cutoff of the blood supply to the heart muscle. So if we recognize these early 7 signs, it can help us to open that artery at the earliest so that a life can be saved. So we have to watch out for these 7 symptoms, and after that there are 3 tips that I want to give to you. The first is don't drive if you have any of these symptoms. Second, call the emergency immediately. Third, seek early help. These 3 will help to save lives. So recognizing these 7 symptoms will help us to save lives. Immediately report to the nearest hospital when you have these early symptoms, and if we are able to open up the artery, it can definitely help to save a life. Thank you.